Hi everyone, my name is Dr. Michael Wald, known as the Blood Detective, and welcome to this presentation entitled Polycystic Ovarian Syndrome, an all too common problem that young people experience, although older women can experience it as well. So I'm going to give you a basic definition of what this condition is, but also a detailed review of the medical and natural and nutritional approaches. I've been in holistic medical practice for over 33 years, and I will bring that experience to you right now. So to begin with, this information is not meant as a substitute for sound medical or health advice. It's meant for education, so please do not misuse the information. So what is PCOS, or Polycystic Ovarian Syndrome? So PCOS is a hormonal disorder affecting ovulation and androgen levels. So the androgens are what they call the male hormones, although they're in women, obviously, like testosterone and the adrenal hormone DHEA. And it is characterized by an ovulatory infertility, or an inability to conceive due to lack of ovulation. And then there is what is known as the Rotterdam criteria, which requires 2 or 3 findings for the diagnosis of PCOS, such as irregular ovulation, high androgens, and the presence of polycystic ovaries that can be determined, for example, by ultrasound. And then in terms of follicles, we know that there are small fluid-filled ovarian sacs that may develop in this condition that may fail to mature properly in PCOS. And then there's ovarian volume, where we have enlarged ovaries, sometimes greater than 10 milliliters, I should say millimeters, which may be seen in PCOS. And here you can see from this illustration of excessive hair growth. It may not be this bad. It may be a lot worse than that, depending on the particular presentation in a given individual. But here are some of the common physical features of PCOS, or Polycystic Ovarian Syndrome. So one would be lack of or infrequent menstrual period. And then there could be complete absence of one's menstrual period. We can also have excessive male pattern hair growth, or facial hair, or hair on the chest and back, or hair in all the places that you do not want. And then there is what's known as androgenic alopecia, where there's the scalp hair is thinning due to elevated male hormones. You'll see that in PCOS, also in hypothyroidism or low thyroid sometimes. And then there's a descriptive term known as acanthos nigricans, which means that there are dark, thickened skin, which is typically found around the neck, the armpits, and that's linked to insulin resistance. Very, very important issue, which we'll talk about in a moment a bit more, the insulin resistant part. And then skin tags, small benign skin growths often seen in metabolic conditions. So in PCOS, it's characterized, generally speaking, as a hyperglycemic condition where blood sugar is too high due to insulin resistance. And metformin, which is one of the common medications used for diabetics, is usually used in this condition as well. But skin tags will form in PCOS, or just someone without PCOS that has diabetes. It's a very important visual sign. So what are the causes and associated conditions with PCOS? As I just mentioned, there's insulin resistance, which is a diminished cellular response to insulin, which will promote fat storage on the body, and excessive excessive androgen production. The androgen hormones, again, are DHEA, the adrenal hormone, and testosterone. And then there's hyperinsulinemia. Because the insulin is not working well, the body makes more of it. So we have excessive circulating insulin on blood work, which stimulates the ovaries to produce androgens. And then we have the luteinizing hormone and the FSH, a follicle stimulating hormone ratio. We have an imbalance between the luteinizing hormone and the FSH, which disrupts ovulation. And then there's the NAFLD, which is an abbreviation for non-alcoholic fatty liver disease, where fat accumulates in the liver, and an ultrasound will show these fatty streaks, and they'll show up on a blood test as an elevation of one or more of the liver enzymes. Doctors do not take this condition seriously enough. They say to you that in and of itself, it's benign. It's benign to have these fatty streaks in the liver. Well, even if that's true, it's a result of metabolic disorder like blood sugar issues. And also it responds very well to nutrition. And then there's endometrial hyperplasia, where there's an overgrowth of the uterine lining due to a hyperproliferation of those endometrial cells, which can increase the risk of uterine cancer, because the more copying you have, the more speedy that is, you have a greater risk of errors in the DNA. And then, as I mentioned a few times, we have metabolic syndrome. So metabolic syndrome is a cluster of three basic things: high cholesterol, high blood sugar, and high blood fat. So these individuals with PCOS, if not treated properly, will tend to have this metabolic disorder with those three conditions. They are often missed, again, by regular physicians because they're not thinking holistically. They're not looking for, let's say, the ovarian problem, and then they'll check the cholesterol, and they forget to do the blood pressure, then the blood sugar. And the medical treatments for PCOS in general are these. As I mentioned, the use of the diabetic drug metformin to improve insulin sensitivity, and it also supports weight loss to some extent. And then the GLP-1 receptor agonist injections, which are medications that also promote insulin secretion and weight reduction. And then there's spironolactone, finasteride, and a few other medications, which you can read here on your own. And then in terms of lifestyle factors that seem to predispose to PCOS, and what to do about it, I should say, we want to start with a low glycemic diet. That means a diet, and I'll show you a chart in a moment, that contains foods that do not cause these violent, abrupt increases in blood sugar. We want the glycemic control of the blood to be just very, very minimal. So we do not want to be eating foods that are considered high glycemic foods. Now, you should visit a nutritionally oriented provider when determining a low glycemic diet, because one individual might respond very differently from a glucose response than another person might. I had a patient who was typically supposed to respond with a low glycemic response to steak, but she had a very high glycemic response to steak and almost no glycemic response to white bread, which makes no sense, except we're individuals, and sometimes there are other compounding factors and genetic responses and other factors that have a person respond in an atypical way. I've never seen a traditional physician, even those that have diagnosed PCOS, talk about a glycemic diet at all. That's probably because they're not trained in nutrition. The average physician receiving about 19 hours of nutrition education over a 7-year period of medical school. So then there's also inositol, which is a vitamin-like compound that supports insulin function and ovulation. And then N-acetylcysteine, or NAC, enhances detoxification and also improves insulin sensitivity. And then there's berberine, a phytonutrient or plant nutrient, an herbal insulin sensitizer. And it's very comparable to metformin for those who do not want to take that medication. I'm not saying don't take your drugs. Take your drugs. Talk to your doctor who prescribed these drugs if you want to try natural approaches. And then there are aggravating factors like BPA and phthalates, which are plastic-derived endocrine or hormonal disruptors linked to hormonal imbalance. And then pesticides and heavy metals are known to produce oxidative stress and inflammation and are endocrine disruptors as well. And then, of course, stress and cortisol levels. We know that chronic stress worsens hormonal balance and worsens as well metabolic dysfunctions. This is just a very quick slide, something like this you can look up online if you're going to try this on yourself, where we have, for example, proteins, which would have, generally speaking, a low glycemic response, and then we have fruits, obviously, that'll have a higher glycemic response, but like I said, you want this to be determined by your nutritionally oriented, well-trained provider. And then we know that there are certain dietary factors that could help PCOS. Now, when I figure out the diet, I base this on a bunch of lab work. And again, I'll talk a bit more of that in about a minute. But generally speaking, we want to consider omega-3 fatty acids because the omega-3s reduce inflammation, they improve insulin sensitivity, and they also may lower the androgen testosterone, which would directly help PCOS. And then there's B6, vitamin B6, pyridoxine. It helps with mood regulation, hormonal metabolism is required for that, and reduces PMS-related symptoms. And then magnesium. We know that magnesium enhances insulin sensitivity and supports adrenal and thyroid health. And then there's zinc for reducing acne, also regulating the immune system and lowering both DHEA and testosterone. The exact dose of zinc needs to be determined for the individual, as well as the exact dose of each of these other nutrients. I tend to base dosing in part on the labs, my common sense, my 33 years of doing this, and also whatever the lab tests show. Oh, and also a body composition, knowing what a client's lean body mass is and providing a certain number of milligrams or grams of a nutrient relative to their lean body mass. That's how you get results a lot faster, by personalizing this. And then there's inositol. It aids in ovulation, improves insulin sensitivity, and also may reduce testosterone levels. So a few other nutritional, I should say, solutions. They may be a solution for some people, maybe not on others. Is vitamin D. Vitamin D is a pro-hormone. A lot of people don't know that. It supports hormonal and immune function, and is commonly deficient in women with PCOS. And the lower your vitamin D, the higher your morbidity and mortality, and this would be a morbidity condition. And then I mentioned earlier NAC, and then also chromium helps regulate blood sugar and reduces sugar cravings. So you're probably getting the idea now that I might want to use several different types of nutrients that manage insulin resistance and blood sugar because they may work differently or synergistically with one another. So it's always best not to just take one thing when it comes to nutrition. You want to go for the super synergistic effects, as they say. And then there's berberine, which is a plant compound that mimics metformin. So some clients of mine over the years have done very well with berberine and have just stopped taking their metformin medication. And then curcumin, which is a powerful anti-inflammatory, and it reduces oxidative stress and also helps to regulate androgen levels. So what are some of the blood tests that you should think about when you're getting evaluated for this? Well, the traditional tests would include DHEA, both the total and free forms of DHEA, and then, of testosterone. So we want a total and free form of testosterone, and we want DHEA, the adrenal hormone, in the sulfate form. So the test is called DHEA-S for the sulfate. As I mentioned, it's an adrenal hormone that will be elevated along with testosterone in practically everyone with PCOS. And then, of course, the luteinizing hormone and the follicular stimulating hormone. Then we want to have the sex hormone binding globulin test, and, of course, the very important hemoglobin A1C, also known as glycosylated hemoglobin, which is a several-week average of blood sugar. You have to do that test to know if the blood sugar is being regulated, because hyperglycemia is nasty. It causes many diseases. Anything from osteoporosis to hardening of the arteries to you name it, it can be even tumor promotion. So what are some of the additional tests that I would do as a blood detective? Well, a fasting insulin and glucose test is just going to tell me more about the blood sugar and how to fix it. And then something called CRP high sensitivity, which is a marker of systemic inflammation, and it's often elevated practically all the time in PCOS. You want to make sure that if you're doing nutrition or you're doing medical treatments or a combination of both, that any abnormalities here are normalized, and they must be checked at regular intervals to make sure that they're being normalized. If they're not going in the direction that providers like myself want, then we adjust everything to push it towards where we want to go. We want a ferritin level, which reflects iron storage, because high levels also will signal the presence of inflammation, and low levels might simply be iron deficiency. So the ferritin is an iron storage marker, but it also can be elevated from inflammation. There's different types of inflammation. We want all the various types of inflammation to go down in a woman with PCOS. And then there is omega-3 index. We want to know what the omega-3 fatty acid balance is in that person, so it can be very, very precise and personalized with the right amount of fatty acids, which we know reduces inflammation, reduces cancer risk, helps insulin resistance, and helps to balance out those androgen hormones. And we also want to add a thyroid panel, and I've given you here the 3 most important thyroid tests to check with PCOS, which is the TSH, thyroid stimulating hormone, the free T3, and the free T4. And in context, when I sit with a patient with this condition, I will give them nutritional supplements that are way beyond the recommended daily allowances. Why is that? The recommended daily allowances, as you will recall, are the governmental guidelines for the minimum amount of a nutrient to prevent deficiency. They're not the optimal amount of a nutrient to deal with conditions like this, but since doctors don't get nutrition training, they look at the list of nutrients you might take, let's say from someone like me, and say, oh my goodness, these levels are super high, they're too high. They're not too high. And of course, you know they're not too high when you look at the various laboratory tests that we've been talking about, and they're moving into the good and healthy direction. And of course, there's the low glycemic food plan, and then the person might have other health issues other than PCOS, so you have to manage all of those at the same time. And PCOS, you should know, occurs mostly in young women between ages 15 and 30. In their 20s is the most common time, and usually it'll begin after the first menstruation. So thank you so much for hanging out with me today and learning about PCOS. Let me know your thoughts about this and other of my podcasts. These are the topics that you've wanted to hear, and I've been doing them. So thank you so much, and I'll see you again soon.